9:30 p.m. and you know, it certainly never fails that just when I think that we won't have anything to discuss, there's some new changes to the PPACA law. So we do have an awful lot to discuss today. Just to start off, as many of you are aware, when you go on to healthcare.gov and try to get an estimate of the rates for central and northeastern Pennsylvania territories and counties, the rates are not showing. The system just spins. This actually has been happening since late last week. And I've been in contact with HHS and the Pennsylvania Insurance Department and NAHU, and finally, after proving to them that yes, indeed, there is an issue, they said that they were able to identify the issue and that they were going to put a fix in. Now, they told me that last night, and I came in this morning anticipated that the rating system was back up, and unfortunately, it's not. So, you know, again, more to follow on that. They're aware of the problem. They say they're fixing it. It's just a matter of when it will actually be fixed. I'm sure everyone heard the late-breaking news last night and also on this morning's news programs regarding the extension of the November fiat saying if you like your plan, you can keep your plan. We all know that originally when that change was allowed by the administration, the decision was deferred to the respective insurance departments. Pennsylvania Insurance Department it actually made the decision based on what the carrier's input would be and allowed the carriers to kind of do what they wanted. For Pennsylvania carriers, really the only affected plans that really you know, went forward with the extension were the Blues programs, the special care programs specifically. Some of them are terminating end of March, and some are terminating in June. With the latest extension of the extension, we're certainly scrambling to find out what's going to happen. And at this point, we were told that the governor's office is meeting with his team as we speak. Obviously, the Pennsylvania Insurance Department is involved. The carriers will be involved. But at this point, I have messages into Geisinger, Highmark Western, Highmark Central, Bluecross of Northeastern PA, Health America, Capital, and the Pennsylvania Insurance Department. So as soon as we get any information on what these changes mean, both for current individuals, the special care programs, the medically underwritten individual and groups, obviously I will relay that information to you. I can tell you that there was a statement from Highmark, and I'll read that to you. It does say that Highmark is committed to helping individuals continue to obtain affordable quality health coverage. We will work with CMS at each of our state's insurance departments, and for their territory is Pennsylvania, West Virginia, and Delaware. They anticipate that announcements on decisions will be coming shortly. Unfortunately, until that is determined, there's not much more information that they can provide at this time. So again, you know, it's still early in the process, and as soon as I get any information, I will certainly pass that on. At this point, it's business as usual, and you know, we're going to keep going down this avenue and this bumpy road until we're told, you know, to turn otherwise. So, you know, again, we're here to support you. It's not an easy thing with all these changes for you and talking to your clients, I'm sure. It's certainly not easy for us to come up with good strategies, but, you know, again, we also are committed to helping you through this process. And you certainly have my commitment that as soon as we hear anything, no matter what we hear, we will relay that information to you. So there was also a vote on the House floor about delaying the individual mandate. That vote actually passed. However, it still has to go to the Senate where it's expected to tank. And, of course, the President has already said that any vote to delay any law to delay the individual mandate would be vetoed. So I don't hold out much hope on the individual mandate being delayed or removed altogether. So again, we're still down this road that the individual mandate is the law of the land, and we have to adhere to that. So I'll bump ahead to the cutoff date. So I guess I didn't include that in my in my agenda. I apologize, but we did clarify that if someone enrolls on or off exchange by 3/31 and have not been covered previously, the individual tax would not be, would not be implemented for any months prior to them getting insurance. So, for instance, if somebody makes application on 3/31, they would get a 5/1 effective date, and if they were previously uninsured, then no penalty would be assessed for January, February, March, and April. Hope that helps with some of the confusion. We are rolling out some enrollment services options for you, and there are going to be a couple options. I know that we talked a little bit about this last week, but this is specific to FFM enrollment. And many of you have stayed the course and fought the good fight with the healthcare.gov systems, and I applaud you for doing that, and certainly you're able to continue to do that. For those of you that have made the decision to not certify for the FFM or just don't want to mess with it, we will have some options for you, not only to help you with those enrollments for your clients, but we'll also have some bilingual people to assist you, not only your Spanish-speaking clients, but also clients that speak Vietnamese. So, again, we're really trying to assist as best we can, and, we hear everyone and their needs, and we're trying to adapt as quickly as possible. So keep watching for that information. We did mention last week that because of the way the cutoffs are for the FFM, at least, again, at this point, we are offering extended hours. Saturday, March 15th is the cutoff for 4/1 effective dates. So our normal Friday business hours are 8 to 1. We are extending our hours on Friday the 14th of March from 8 to 4:30. So we will be working a full day that day, and if you want an application submitted for off exchange, or on for that matter, then you need to submit those applications to us no later than 2:30 on Friday, March 14th. The close of the FFM for enrollment in 2014 without a qualifying event is March 31st. So March 31st is a Monday, but because we expect pretty heavy volume, we are extending our Friday, March 28th, I believe it's 28th, yes, March 28th hours from 8 to 4:30 as well. And again, that's cut off for May 1st effective date, and we would ask that you send those applications to us Friday, March 28th, no later than 2 p.m. On Monday the 31st. But you can send them, all day on Friday the 28th, but they may not be entered until that Monday the 31st again. So anything that is sent on Monday the 31st, we really need those apps by 2 o'clock at URL so that we can get them in the systems for the carriers. There's an opportunity, again, I promised that we would start talking strategy, and even though short-term medicals and limited medical programs are not HHS and PPACA compliant, there is, a thought process and a sales process out there that people are talking about short-term medical programs and offering short-term medical programs even though they know that the individual tax would be assessed. The short-term medicals and limited medical programs certainly are less expensive than most of the PPACA plans for your non-qualified, non-subsidy qualified applicants. But just so you're aware, they're still selling them, but anyone that purchases them would definitely be subject to the individual mandate tax. But again, if you net out the cost, then maybe that is to your client's advantage to take a look at them. So just keep that in mind. Renewals equal a special election period. I wanted to reiterate there was some confusing information on healthcare.gov, but if you have an individual health policy that's non-PPACA that renews sometime in 2014, that is a qualifying event and throws your client into a special election period in which they can apply either on or off exchange for any qualified, HHS qualified plan that they choose. So just be mindful of that as we come to a close on 331. You know, that certainly is a new area that you may want to identify some new prospects, and I encourage you to do that. BORs and commissions. At this point, you know, as I mentioned in my previous webinars, the carriers are starting to trickle in payments, commission payments for 1/1 and some on 2/1, but that in no way should be taken as a complete list because, again, the payments being matched to the policies has been a little bit of a challenge for the carriers. So, you know, again, watch your commission statements closely. Please keep, as I mentioned way back, please keep a listing of all of your clients that you sold on exchange, and if you don't see commissions coming in for them, then you need to let us know and identify that. We do have now BORs from several carriers, and they're on our website. One is Geisinger. The other is for a BOR process is Independence Bluecross, and then Highmark Blue Shield Central and Highmark Bluecross Blue Shield for Western. They've just released a BOR procedure. So again, all of that information is on our website and is included in, will be included in the Healthcare Reform Essentials newsletter that will go out today or tomorrow. So that's good news, I think. Another issue that's been coming up on the FFM when somebody is losing group coverage on 4/1, you have to really be mindful of the termination dates that you put into the system. A termination of a group plan effective 4/1 is actually 3/31. So you have to make sure that you're not putting 4/1 in, that you're putting 3/31 in, or whatever the dates are moving forward. I just lost my, I apologize, guys. I'm telling you. Some days it's probably better just to stay in bed, right? And there we go. My apologies. So again, just be mindful of the dates that you put into the system because it will affect the requested effective date. We are continuing to hopefully offer helpful webinars. We have our Highmark Blue Shield webinar coming up at 10:30 on Wednesday, the 12th of March, which is next Wednesday. Some of the topics for discussion will be the enhanced network versus broad network, and you know what it means specifically for the Community Blue members and services outside the enhanced network. Kind of an insight onto what the biggest sellers are so far, the plan designs, the proper billing procedure protocol for inside and outside the exchange, how you add or delete dependents for both inside and outside the exchange, how does one change plans inside and outside exchange, and of course we do have the BOR information that we just shared, but we'll go into more detail on that. And then any insight on what happens upon renewal for the PPACA plans inside and outside the exchange for the 1/1/15 effective date. We just set up another webinar that we're holding on Thursday, March 20th at 2 o'clock, and this is for Capital Blue Cross. And although Capital is not as competitive as they had hoped to be for the 2014 selling season, they do have some niches that I think that would be good to keep in mind. You know, they have a very competitive catastrophic program. So if you do have somebody that falls within, you know, falls below the 100% of the FPL and above the current Medicaid guidelines, even if that person is over 30, they're eligible to apply on the exchange for a catastrophic plan. So you may want to take a look at Capital's catastrophic program, you know, and also for any young people that under 30 that want to choose a catastrophic plan. They have a very, very competitive standalone dental plan. So they're going to talk a little bit about those and what that means for both on and off exchange. These are sold on and off exchange, and outside of any enrollment period. So I think that might be another opportunity to strategize for after 3/31, and what their plans are for 2015. You know, how they are planning on being competitive, and you know the steps that they've taken in order to make sure that they can predict the 2015 rates, so that they are competitive in the 2015 selling season. And of course, they had originally come out and said the medically underwritten programs that were sold in 2013 would terminate November 30th of 14, but they have since extended that to 12/31 of 14. You know, again, at this point, I have no idea what that's going to mean with this current extension. But again, I think hopefully that there will be a lot of good information that you'll hear on the webinar. So please, when you get that invitation, join in if you'd like, and hopefully learn something and gather some marketing tips so that you can go and you know, be prosperous. We did have a few submitted questions, and one comes from Charlie. He says, do you have to pay the entire deductible before the insurance kicks in? And Charlie, this really depends on the plan that you choose. If there's a copay, the doctor visit copay, of course, comes in before the medical deductible. And of course, HSA, the deductible has to be paid before any co-insurance is paid. But just be mindful that whether you're selling plans inside or outside the exchange, any out-of-pocket maximum, anything that's applied towards that out-of-pocket maximum, let me rephrase that, any deductible copays, prescription copays, they all roll up to the out-of-pocket maximum total. So that is different than plans previous to 2014. But when you're looking at a $6,350 out-of-pocket maximum, that includes your deductibles, any doctor visit copays, specialist copays, hospital copays, and prescription copays. So that may help in your selling. And Joshua asks, what are the exact income bands used to determine rates? And the rates are actually based on ages, not income, but the subsidies themselves are based on the percentage of FPL. And, you know, for somebody that is, there are quite a few, and it breaks down, it might actually be very confusing, but somebody up to 133% of the FPL can expect to pay 2% of their premium maximum. 133% to 150% will pay anywhere from 3 to 4% of the premium, and it goes on up to 300 to 400% of FPL. They can expect to pay a maximum of 9.5% of the premium. So I'm not sure if that quite answered your question, Joshua, but if you want to give me a call afterwards, I'd be happy to get more specific with you. James asks the question, how will the latest change, keep your plan, affect our business? I think that at this point, you know, we discussed everything that I know at this point about what any possible extension would mean. And, you know, again, anything that I can find out, I will certainly relay that information as it comes in. So at this point, we're going to open it up for questions. I suspect that there will be a lot of questions. I do see that somebody has their hand raised, so let me address that first. I'm going to, the question comes from Ann, and I'm going to unmute you, Ann. Ann, do you hear me? Okay. Well, then we'll go right to the submitted questions. If you do have a question, you can, again, either raise your hand or you can type it in the question chat box below, and we'll get to as many as we can. Ed says, can you give us any information regarding the CHIP program and timeline for effective dates? And Ed, I'm not really sure what you're asking about, regarding the CHIP program. I can tell you that a child up to age 19 of parents that make up to 314% of the FPL, when they make application on the FFM, those children are cordoned off onto a CHIP program. The CHIP process in and of itself within the FFM doesn't seem to be, going as quickly as it could. If you have somebody that you know is going to be redirected to the CHIP program, I would encourage you on the FFM to click the button that you want to have the child sent for Medicaid or CHIP determination. But I would go an extra step and either enroll them on the PA Compass site for the CHIP program, or call the carrier directly, or have them call the carrier directly and get them signed up with the carrier that they choose that offers a CHIP program. Kind of the best way to do it. Jamie says he has a client who's receiving subsidies through the FFM. They would like to get another part-time job this year, but are concerned that they will be penalized for increasing their income and will have their subsidy reduced. Is there a chart available on exactly what the breakdown of income levels, subsidy amounts, if so, that they can try to plan their income appropriately? And Jamie, absolutely. I think the best chart right now is if you go to our website under URL Health Plan Options and then Product Information. If you go to Highmark Blue Shield Central, there is a brochure that says it's an individual's guide to the right health insurance, and there is a pretty comprehensive chart that talks about household size and expected household income. Not only for the subsidy, but then also the second level of assistance, which is the cost-sharing subsidy. So I would encourage you to do that. Joe says, can you explain or offer any ideas on how to expedite CHIP enrollments for family clients? Joe, I think I just answered Ed on that, so hopefully you were able to hear that. If not, maybe you can walk down the hall and talk to Ed. Colleen says, actually, this is Sean. He says, I think I heard on the news this morning that they have extended the enrollment deadline on the FFM to April, correct? And I did not hear that, but let me check that out. I absolutely didn't hear that. The only thing I've heard was the extension of keeping your plan. So let me check into that, and I will include that in my healthcare reform newsletter one way or the other. And Ann says, dependent daughter receives Social Security deduction for Medicaid from Social Security check. Should that be included as part of income on application? Mother is submitting on the marketplace. And Ann, I don't know how to answer that. One of the things that we as agents are required to do is become familiar with all the tax laws, and I'm sorry, but I think we've all been a little bit busy that we don't know what the tax laws are. All I can tell you is that there are questions about credits that are asked on the FFM, and you should answer those honestly. And I can tell you that when they're estimating income for the household, Social Security payments, including disability payments, are included but not SSI. So, that's about all the information I can tell you right now, Ann. I would possibly have your client call their accountant and find out how that income is counted. Or get onto the FFM and just answer the questions that are asked and let the chips fall where they may. Tim says SSDI is included as income, correct? And Tim, you are absolutely correct. So it looks like those are all the submitted questions. So if you have any additional questions, make sure you type them in now. If there are no further questions, the next webinar is next Thursday at 9:30. That's Thursday the 13th. So again, we'll continue to offer these as long as they're helpful, and quite frankly, with everything changing so rapidly, I anticipate that we'll offer these at least through the end of April. As always, I really appreciate all of your support and your kind words, and you know, and your support and loyalty as agents. If you're licensed with us and submit business through us, I truly appreciate your partnership. If you're not, then again, I ask you, if your current general agency is not offering these services, then, and you have to come to us, then please consider transferring us to us for your carriers, because we are committed to the agent partner market, and we support you wholeheartedly in all of your trials and tribulations, if you will. So again, thank you so much for your time today. Have a great day and have a great weekend. Bye-bye.